Let me start with the question about the new CDC study data you guys have published today related to Omicron and boosters. And I think the headline grabber is that the Pfizer Moderna vaccine is about 90% effective in preventing hospitalizations and deaths for those who've gotten the booster. Why do you think it's so effective in that case, but also why are we seeing so many cases despite that efficacy?
Yeah, really important question. So yes, as you know, really important studies out of the CDC today demonstrating the benefit of that booster shot specifically against Omicron. So what we're seeing now, and I will tell you, Alabama has a 30% booster rate. So that may be one reason why we're seeing so many cases is that we haven't yet done as much as we can in order to get everybody boosted, which is why I'm here today. What we do know is over time, we have seen some waning effectiveness of the initial two shots, the primary series of the vaccine. And we've also seen that with the Omicron variant, we have enough of a change to the variant that it hasn't responded as well initially to the vaccine. So those two things coming together meant that those two primary series hadn't been working as well, but really good news now, demonstrating that with that booster shot, you can avert hospitalizations by 90%.
You mentioned our low vaccination rate, whether it's booster or overall, and our high positivity rate, which this morning stands at 46.3%. So I wonder, is the CDC considering giving our state more of those monoclonal doses specifically targeted to Omicron? Again, the formula we've been hearing from doctors over and over again, there just simply is not enough supply in our state to treat the patients specifically with Omicron who need it.
Yeah, I think several important points here. First of all, I will say many people, especially with high case rates, are really working to obtain not only the monoclonal antibodies, but also we have many other things in our toolbox. We have the Paxlovid from Pfizer. We have remdesivir used as an outpatient infusion, many other things. But the most important thing we can do with Omicron is to prevent it in the first place. And so what I would say is in order to do that, the best way to do that is to get your primary series, get your booster when you're eligible, and wear a mask in those public indoor settings when there's so much disease around.
You mentioned, again, let's go back to the low rate of vaccination in our state, booster or primary. Some folks and Alabamians would argue, Dr. Walensky, that part of the problem is a messaging issue from the CDC and the federal government. And simply that is, they get a lot of what they believe is conflicting or confusing guidance on what to do if I test positive, what to do if I have the sniffles or a sore throat, if I have a rapid test versus a PCR. There is just a lot of information out there, and at times conflicting information, it seems. So how much of this problem with vaccination rates perhaps is a messaging issue, and how do you resolve that?
You know, I would say really importantly, our job at the CDC is to follow the science. The science is moving quickly. The variants are moving quickly, and we continue to update our guidance in the context of that science. But what I'm here today to do is to deliver a very clear message. If you are unvaccinated, get vaccinated. If you are eligible for a boost, get boosted and wear a mask during this really high amount of disease and this surge. You have low vaccination rates in Alabama, get vaccinated. Low booster rates in Alabama, get boosted. And please wear your mask to protect yourself and your loved ones.
Let me talk about the future of this. And we've gotten through Delta. Now we have the Omicron surge we're in the middle of. The hope is perhaps we're near or at the peak of that. What does the next variant look like? If the Omicron is milder, it would appear. Perhaps that's one of the reasons folks are not taking as the precautions they did in the other surges. What does the next wave of this look like? And perhaps bigger, when do we get to the point where this is an endemic rather than a pandemic?
Yeah, really important question. I think right now what we need to do is sort of look down the field and see where we're going. Are we getting toward endemic? Wouldn't that be great? But also to prepare for what might happen if there is another surge ahead. So we're planning for all of those scenarios. But in this very moment, the important thing that we can do is look to our hospitals. Certainly, we've seen data that say case for case, Omicron may be a less severe disease, but if we look at our hospitals, we can say there is still much severity there, and that is because of the sheer number of cases of Omicron. So please don't be reticent and suggest that we are in a good place because Omicron is milder. Our hospitals are full, and we really need to get people vaccinated and protected and boosted.
Birmingham, as you know, a medical center for the Southeast, especially with UAB and several other tier 1 hospitals here. I wonder what message you would have for the healthcare providers in our state and the teachers who are dealing with exhaustion, fatigue. They have been through so many of these, and now we're going back to a place that's very dark for so many of them, and they were more tired than ever.
Yeah, I would say, you know, a year ago, I too was on the front lines caring for patients with the healthcare providers at UAB and across the state, and also our public health officials. This has been hard. This has been exhausting, and these are the true heroes that the history books will write about. And we are there in solidarity with them and grateful for all of their service.
Part of one of the effects of this, Dr. Walensky, is that our nation has sort of built, not for the ground up, but certainly radically expanded its testing infrastructure, its public health infrastructure. There may be no more funding ever that has come to public health in the last couple of years. So whenever we do get to the point where COVID is more like the flu, what do we do with all of that infrastructure, the lab capacity, the workers who are now churning out tens of thousands of samples a day, the testing sites? We have all this infrastructure. At some point, the hope is from all of us that we don't need it. What do we do with it then?
Oh, I would actually say we need it badly. And part of the reason that we have had so many of these challenges with this pandemic is that it was frail to start. So studies have suggested that our public health workforce in this country is to this day still 80,000 persons in deficit. What we really need to do is we need to upskill our workforce. We need to expand our public health workforce still. We need to expand our laboratory capacity. We need to modernize our data so that we have a much more robust public health infrastructure in this country so this never happens again.
Finally, Dr. Walensky, I want to circle back to where we started, and that is simply a message you would have to Alabamians who are skeptical either of the Biden administration, of the federal government, or doctors in general who say simply, I believe in what I can do, I believe in the protections I'm taking, and I'm not so sure I want to either get a first and second vaccination or a booster shot. How do you overcome that skepticism of folks who simply say, I don't think this is the right course for me?
Yeah, what I would say is go talk to someone you trust, someone in the healthcare sphere who has been handling and taking care of patients, someone in the public health sphere, someone in your pharmacy sphere who you trust. Trusted healthcare professionals have almost universally said, we really do need to get people vaccinated and get people boosted to protect them against Omicron.
Dr. Walensky, I know you're very busy. We certainly appreciate your time. Thank you very much.
Thanks for having me.